Greetings and welcome to Village in Motion. I'm delighted to be able to introduce this morning our first guest, who is Vicki Halden, the assistant manager of our rehab, outpatient rehab. Is that correct? Is that the correct way to put it, Nikki?
Well, I'm the assistant manager for rehab.
For rehab.
I'm currently stationed in outpatient.
In outpatient. All right. So your office is over in Hunters Crossing.
Yes, ma'am.
And you were telling me that you had been here for 12 years.
Yep, it'll be 12 years this upcoming May.
And you started splitting between Garden Ridge and outpatient, and now you are mostly here in outpatient.
Correct.
Overseeing outpatient.
Right. When I first started, I was completely doing resident care, and I would do half in Garden Ridge, and then my afternoons would be in outpatient. And then as times changed and the assistant rehab manager role became an option, I applied for that, and luckily I was offered that position, and I took it. And so now I do mainly administrative type activities.
And
but
your
I also
background is physical therapy.
Absolutely, yes, ma'am. I am a physical therapist.
When you get in a pinch over there, do you also jump in and do physical therapy?
Yes, ma'am. That's what I went to school for, so I don't want to lose that skill set, or that's what I enjoy as well. So it's a nice mix.
Where did you do your schooling?
I went to the University of Virginia for my undergraduate degree in sports medicine. And then I went on to graduate school at the Medical College of Virginia in Richmond and received my master's of physical therapy there.
Very impressive. All right, good enough. Nikki, let's talk a little bit about assistive devices. You and I had talked a month or so ago about the fact that there was some confusion on the part of a number of residents, particularly those that are for the first time needing rollators and such things. And we thought that a program this morning might provide some clarification for folks.
Absolutely.
Now, in the past, we have been able to get rollators, and of course you can buy rollators at Walmart and Target, and often our neighbors, have an extra one that they're willing to sell us or whatever. So the sources are all over the place. And so people appear. I have myself a rollator. In fact, I have two rollators. With rollators that are not always the right height. Sometimes we don't know how to use them. So I know there are some complicated factors with these. They're not complicated machines, but on the other hand, they do have to be used properly. Now, that having been said, what is the procedure these days in terms of trying to get them adjusted size-wise, trying to learn how to use them?
Right. So, in the past, like you said, I've been here 12 years, so things have definitely changed over those 12 years, and that goes in, with Medicare regulations changing, the corporate offices taking a look at really our processes and what is most appropriate to keep everyone safe and healthy. Yeah. So, we used to just, if somebody dropped down to the outpatient department or over in Garden Ridge and had an assistive device, we would, as a courtesy, adjust it to the correct size. And now looking at our state, our policy and our Practice Act, which is governed by the Board of Medicine, we really have to be practicing under the supervision of a physician. Although all physical therapists have their license as a physical therapist, they take an exam and must pass it through the Virginia Board of Medicine, we do have to have a referral from a physician stating why this person needs an assistive device.
All right, now let's stop right there. They need a physician referral if they need it adjusted. Is that correct?
Well, that's pretty much what we've come up with. We have a process that we want everyone to be aware of. And if someone has been utilizing an assistive device, let's say they've used a cane for years and someone, in the past has taught them how to utilize that, but now they feel a little bit more unsteady and feel they need to move on to something more stable for them that gives them more support, such as a walker or a rolling walker or a rollator. Really, they need to see their physician first, because these changes in balance may be caused by some other factor that could be medically managed and prevent them from having to be using an assistive device in the first place, or going to a more supportive device. So we don't want people to just choose, okay, I feel unsteady, I'm going to go get this device and just have someone size it appropriately for me. They should see their medical physician and say, these are my concerns. I've noticed that I have more difficulty walking longer distances, and I'm veering in the hallway, or I've fallen multiple times and I don't want that. So by seeing their physician, the physician can evaluate what's going on with that resident. Is it something medically that they can manage that's causing this? Do they have vertigo? Do they have a UTI, which can cause a fall? Rather than automatically assuming that they should use an assistive device. In the instance where there isn't something medically that can be managed by medication or through the physician, they can refer the person to physical therapy for an evaluation to, one, see what's going on. Are there muscular deficits that can be addressed? Are there balance deficits that can be addressed? Because even though you do have a balance problem, you can learn to modify your balance without having to necessarily stop from walking without an assistive device.
So there's some compensatory behaviors.
Absolutely. Balance is a very intricate thing. It's not just, getting up and walking. It includes your vision, your inner ear. It includes muscular supports. So physical therapists can address multiple different avenues. So if one thing isn't working properly, we can use other strategies, teach you other strategies. We can also affect changes in your balance through physical therapy by different modalities that we can utilize, including exercise and balance retraining. And at that point, if your balance hasn't changed and we feel that the most appropriate avenue is to have you utilize an assistive device, we can then decide what assistive device is most appropriate. So you don't necessarily have to go from walking with nothing to a rollator or a walker. Maybe a single point cane would be most appropriate at that point in your life.
All right, Nikki, let's stop just for a moment. If you decide that, let's say a rollator is indicated for a particular situation, in that case, does Medicare cover the rollator?
Medicare will not cover rollators. Those are the devices, if someone doesn't know what they are. Right. They have the hand brakes. They have a chair that you can put down, a seat, so that if you're walking longer distances and need to rest, you have that capability. And it's got the 4 wheels. Medicare will pay for a standard rolling walker, the silver ones.
Right, the aluminum.
Right, which have wheels in the front and they fold for easy compactness.
All right, so they will cover that.
They will cover that.
And those are $40, something like that?
It depends, but typically Medicare will cover it as long as you have met your durable medical equipment deductible. So
what about canes? Do they also cover
canes? They will cover canes.
Of course, canes are so inexpensive.
Right, so I always tell residents, you can go down to Neighbor Care and purchase a cane for I think $15.
No, they're some of them are $5.
Okay, so see, I'm way off the chart. Right. But you have to look at if you're paying, do you want Medicare to pay $5, $15 for a cane, wherein maybe in the next 6 months you might need another assistive device, and they'll say, well, we just purchased a cane for you. So, if you haven't met that deductible, then it brings on all different concerns.
Right.
But,
all right. So if a rollator or a cane is indicated, then you will also then participate in the sizing of them? Or?
Absolutely. Through, the size is very important with a cane or a walker, because there are certain things we need to look at. It needs to be adjusted according to your height and what best fits for you. There are general guidelines that we utilize. If you're standing, one of the things we look at, if you're standing with your arms straight, hanging by your sides, the assistive device should be at about your wrist level, so that when you hold on to the rollator or walker or hold the cane, there's about a 20 to 30 degree bend in your elbow, and that's because that's the most mechanically advantageous position to utilize. So if you do lose your balance, you have the ability to push and use your muscles correctly versus completely straight, or if it's up to here, you can't get that good stability. So we do need to size it appropriately and make sure that you are using it correctly.
Yes.
There are certain ways to walk with a cane or with the rollator, and getting up with an assistive device is different than when you don't have anything. And a lot of times when people have new assistive devices, their tendency is to pull up on the walker or rollator, or to have that cane here and try and get up, which actually can cause them to be more unstable at that point. So learning how to use the assistive device correctly when you're getting up and sitting down and walking appropriately with it is of utmost importance, because it can lead to a fall if you're not using it correctly.
Yes, I can believe that.
So, you know, the best thing to do is to have that training. If you choose to purchase your own assistive device because you feel unsteady, if you look at our State Practice Act, we have to abide by that. And it says that we need to practice under the supervision of a medical physician. That could be a chiropractor. It can also be a nurse practitioner. It can be a MD or a doctor of osteopathy or a physician assistant. But they are responsible for kind of overseeing us as well, because we're making an assessment. And if the doctor hasn't seen you and you're unsteady, they haven't been able to determine why that unsteadiness is occurring.
I understand.
So we can't, in the past when we have done that, people have come down, oh, let me check this. We are making an assessment of the appropriateness of the assistive device and how well you're utilizing it, and legally and by state law and Medicare guidelines, we really shouldn't be making those types of assessments.
All right, so to sum all this up, I understand you absolutely have to abide by the situation.
Right.
All right, so the bottom line here is that folks should not come down to outpatient rehab and expect, without a doctor's order, to have you adjust their rollator.
Right.
As you have in the past.
Right.
And that came as a shock to a number of people.
Right.
Didn't it?
You know, it's a little different with someone like you who we've seen and we've treated, and you just need it readjusted.
Or
as
I may
far
have bought
as,
a new one.
Right.
That needs
And
adjusting.
we're making it equal to the last one, and we
Right.
know that you've
Right.
been trained and that you're using
So
it
that's still
appropriately.
all right for people who have been using them, who have used your services?
Well, it depends on timing. Like you had just recently seen us.
Right.
So, but if it's been months since we've seen you,
Or
and
years.
then we really should not be doing that. And that's to protect you as well as to protect us, because if we change the height of it and you aren't used to that, because some people will have them adjusted up to here because they think it makes me stand taller, but really your arm should be down here.
Yes.
And that change can really affect how they walk and what their balance is like.
Well, and rotator cuff issues when it's not at the proper height, I think many
Right,
folks
shoulder.
find.
And it
Shoulder.
can also cause neck issues because people are jammed up here, and so they're all connected.
Yeah, it can be a serious thing.
Right. So the proper way is to discuss it with your physician, get that referral, and then let us know. If we get the referral from the physician faxed over to us, we'll call you immediately to set up an appointment. Otherwise, if you have it in hand, you can call us at the outpatient department. And you typically, if it's just for that, to make sure that you're utilizing it correctly and it's the appropriate height, usually it's the evaluation and then maybe one or two more treatments to ensure that you're doing
Using
everything
it properly.
correctly so that you stay as safe as possible.
Well, Nikki, this is extremely helpful. I can't tell you how much I and I'm sure a number of our residents are going to appreciate having this information. So I think with that we'll close, and many thanks for coming and having this discussion this morning.
Well, you're quite welcome. Thank you for having me.